Hello everybody. I wanted to do a quick YouTube video about my process from having a pain pump placed surgically inside of me and just bring you along for my recovery so other people that are going to have it have a little bit of an idea of what to expect. I'm 41 years old. I'm a mom of 4. I have a few health issues. My primary reason for getting the pump was due to chronic pancreatitis, which was secondary to sphincter vodi disorder, as well as a lot of lower back and what I call hip pain, but I guess it's like sacral joints. So those were the 2 reasons. I've been on pain medication for about 6 years. Had a lot of surgeries to try to help, different things. Tried to do the pain pump 3 years ago. I just wasn't healthy enough to do it per the doctor, so it was put off till now. I had a doctor with IU Hospital. I did do a trial where he did an injection directly into my spinal fluid and to see how that helped me. Before the trial, I had to wean down my medication and go Saturday and Sunday with no medication, and then on Monday do the trial. I said that the trial gave me about 50% to 60% relief, which is considered positive, so I was approved for the pain pump. I had to, a week before surgery date, which was yesterday morning, I had to wean down off of my medication to also go or be 3 days without any pain medication. So I did not take any medication on Saturday, on Sunday, or on Monday, and my surgery was at 6 a.m. on Tuesday. My pump is filled with Dilaudid. It started working as soon as they put it in. They filled it with medicine. I also have this external pump, which is, it's got a little catheter that goes to my surgical sites, and it basically has like some kind of a lidocaine or something in it. So it says it keeps the surgical sites numb. It does keep it numb. That doesn't mean there's no surgical, pain. The cut may be numb, but you have to realize that the doctor is going to cut you open underneath one of your ribs and put something the size of a hockey puck inside you. He has to pull up muscles and fat and whatever and put it in the right place. Then he also has to feed these 2 tubes, thin tubes, around your side into your actual spinal, in between your spinal cord, and get it into the fluid. So you also have a cut on your back that's about 2 inches. My cut on the front is, with the dressing on, I'm going to say I think it's about 6 to 8 inches. So I think that I believed that because I was going to be numb at the surgical site, that I wouldn't have a lot of pain. I knew to have soreness and things like that. I didn't think I would be in pain. Let me just tell you, I am in pain. It's been over 24 hours since the surgery. I came home at about 1 p.m., so I was there from the actual surgery time at 7:30 till about 1, so to kick you out pretty quick. I slept a lot yesterday, but from about 3 o'clock in the morning to today, I've only been able to sleep 1 to 2 hours at the most at a time. I'm hungry, but my stomach is very nauseous, so I'm eating things like applesauce and popsicles and just trying to drink water or Gatorade. I have to get help sitting up. One of my kids have to, kind of pull me up, let me pull on them so I can get to a sitting position. One thing with this external pump, I cannot shower while it is in me. So Sunday, I actually have to pull the tube out of my skin myself. So we'll see how that goes. I'm not looking forward to that at all. But today I was able to get up, and I stood up long enough to just kind of take a warm washcloth and wash my body down as much as I could without, you can't bend over, you can't twist, you can't reach, you can't lift. For at least 30 days, I have a binder on, so I, as best I could, washed myself. Made me feel a little bit better, a little more human. And also, one other thing, my doctor set my pain pump up at to give me a little bolus injection at 7 a.m. and 7 p.m. He did send me home with the remote for the pump, but it is not set up yet. I tried to use the remote today thinking that my son kind of misunderstood that I could use it up to 2 times in a 24-hour period, and every time I tried to use it I was getting an error, not realizing he had my actual machine, my pump, giving me the bolus already, and so I did not need to use the remote control yet, so he had not activated that. So when I called, I talked to his nurse, and she explained that to me, and I told her that I was in a pretty significant pain, very uncomfortable,